Hi everyone. Now this is the graveyard session, but hopefully you're all wired on your double cookies that we all had with our tea. So this builds really nicely on the previous presentations. And I'm going to talk about this tool that we developed. Maybe I'll have the partners later. So why did we need a tool and a digital tool for social emotional development and mental health? So in our work in early childhood, as Kaylee presented earlier today, our focus has been on executive function and early learning, but working at a community level has really highlighted some of the more broader holistic developmental issues that we need to be cognizant of. And we know in South Africa, a country that is living with many the legacies of apartheid and colonialism, that there's a serious lack of accessible services for children with developmental challenges. And we can't fix the whole system, but we really wanted to see, could we build capacity at a community level with caregivers, which is mothers, fathers, grannies, other relatives, and community-based workers to promote these aspects of children's development and well-being in the age group that we've been working with, the 3 to 5s. And due to some opportunities that came our way, which I'll explain, we have seen how digital platforms can really help to leverage the potential to reach a broader range of children and caregivers in vulnerable settings, more so than everything done one-to-one. So the aim of this tool was to take a co-design approach. It built on many of the relationships we've developed with community-based organizations working in early childhood development and vulnerable settings. And we wanted to have something that could firstly assess social emotional development and mental health in young children, but not only just assess, but actually provide some understandable and simple, meaningful feedback on these results. And then in addition to that, provide some contextually relevant resources for caregivers of young children, not to replace professional services, but to really build from the community up some awareness and literacy around some of these issues. And many of the topics that were discussed earlier in terms of harsh parenting, in terms of structural violence, these are things that are really risks for early childhood development in vulnerable settings in South Africa. So we had the opportunity to join this network called Series, which is connecting the ed tech research ecosystem, which is hosted by the University of California in Irvine. And we've partnered with some community-based organizations, some of whom are listed here, as well as many other stakeholders, to co-design this tool, and we are working on piloting it at the moment. And so the co-design process involved firstly doing a large number of focus groups to understand for these organizations working in early childhood development, what were their priorities and what is their context? And also to say, these are our initial ideas for the tool. What do you think? Could this work? How could this fit into the work of your organization? Is this important to you? Would this be a burden? All of those kind of things. And the tools that we actually suggested as a starting point was the Strengths and Difficulties questionnaire that has been used widely, has been translated into some South African languages, but needed some adaptations, as well as the Social Emotional Subscale from the International Development and Early Learning Assessment. So in our settings, going with a completely blank page is sometimes quite difficult to get off the mark. So we really wanted to present some initial ideas and get their input on that. We then worked with the team in California to develop a tool prototype, which was on WhatsApp, since that's the most easy to access and easy to use platform in South Africa, and I believe in many other majority world countries. So that developed the first prototype. We then took that to some more organizations and stakeholders to say, this is what we have. What do you think? Could this work? Is it simple enough? We then made a number of adjustments to the prototype in terms of reducing the complexity, kind of figuring out what was really important to keep in or take out, and then finalized the tool, trained community-based organizations, and then, as I mentioned, we're piloting at the moment, and we'll finish that at the end of October, and then evaluate. So I'm sure many of you are familiar with the strengths and difficulties questionnaire, so I'm not going to go through it in a lot of detail, but these are questions asked to the caregiver about the child, and then the IDELA social emotional subscale is asked to the child themselves. And for these questions, if you may not be familiar with them, it's not so much about the actual answer in terms of the strength and difficulties questionnaire asks them to give a response on a Likert scale, whereas the IDELA social emotional questions are more, is the child able to give an appropriate answer? So for example, what makes you happy? If they answer getting hugs from my mom, eating sweets, playing with my friends, that's correct. If they're saying, being beaten by my parents makes me happy, that's an incorrect answer. And incidentally, spanking means beating in our country too. So what did the organization say? And maybe I should just highlight, in South Africa, early childhood development organizations really are the glue that holds our early childhood sector together. The government is quite famous for kind of not putting things in place. We don't have free and available early care and education services, so parents often have to, in the midst of financial difficulties, pay for their children to attend a preschool, or what is often called a creche. So these organizations really form an absolutely critical part of the system in our country. And they really highlighted that social emotional development and mental health of young children were very important topics to address. And the name of the tool, which is Mazi Umntanakho, means know your child. And some of the feedback we got was that we don't know our children, or our parents never told us they loved us, so we don't know how to say that to our children, or we didn't know that children could experience stress. So it was really just highlighted the need to address these gaps in knowledge and awareness, and that these were really important topics. Although many of the organizations, when we initially spoke to them, they said, oh yes, we are doing these things. But when we really went through it in much more detail, they highlighted, okay, well, maybe we're not doing it as much as we thought we would. So definitely highlighted this was important and needed for them, but also that many of these challenges are still really stigmatized in many of these vulnerable communities. In terms of, say, a child with ADHD or on the autism spectrum or having any other disability, we heard stories of children being locked away, not being allowed into the community, and parents just having a general sense of, we don't know what to do, or we don't really want to own up to this being the challenge. And as we expected, this lack of accessible services. So even if services were available, the awareness of how to access these services, how to navigate them, was really limited. And in our settings, transport is really expensive. So you can get a referral to a government hospital, but who's going to pay for you to go there? And are you able to take off a whole day of work and lose a day's worth of wages, or take a day's leave to sit at a clinic or a hospital waiting to receive help? And also just recently, some of the discussions I've had with people working in this area is that often services are quite fragmented. So one day you need to come see the speech therapist, and the next day you need to see the OT, and the next day you need to see the pediatrician. So many people in the sector are also trying to coordinate those better to relieve the burden on caregivers. And the assessments that we proposed, the SDQ and the IDELA social emotional scale, those were perceived to be acceptable for these communities. That, as I mentioned, WhatsApp was the best digital platform to use. But in South Africa, we need multiple languages. We have 11 official languages, including English. And, the resounding feedback was that we need this in our language. If we have resources, we need those in our languages. And the importance of how does this get integrated in the existing work. And I'm sure many of you know, across multiple sectors, if anything's perceived as an additional burden, the likelihood of it being implemented is very small. So same here. So just very briefly, what the tool looks like. It's a WhatsApp chatbot. I don't know always how popular WhatsApp is in other countries. I know in the US it's not used as widely as it is in South Africa, but basically it's a question, you pop in a number, and up comes the next question. And then we use a traffic light system. So this was part of giving simple feedback. We've tested it out in other projects and it works really well. So green, everything's good. Orange or yellow, some things to keep an eye on. Red, this needs extra attention. So the feedback they get is not a raw score, but is actually one of these traffic light colors. And then the really cool part, we thought, is the resources. So we worked based on the feedback we got to develop these contextually relevant resources. They said they want text, they want infographics, they want videos, they want voice notes. So we made all four. And we chose to focus on 5 themes. So instead of adding to the stigma by giving a child a label and saying, here's a flyer about ADHD, we thought, let's cover general topics that could be beneficial for everyone. So those are self-awareness, social skills, emotions, difficult behavior, and healthy habits and routines. And we've got infographics for those, and then translated into 8 other languages. We left out 2 because they're not as widely used. And in the pilot, we are piloting 4 languages. So the feedback so far, the pilot is going well. We did a follow-up visit in July, but as in many interventions, the need for ongoing support for implementation is really important. In our rural areas where this part of the pilot is happening, network coverage is not great. We don't have a continuous supply of electricity, so that knocks out the networks as well. And so we've had to have some paper workarounds. And not surprisingly, children and caregivers respond really differently, some really positive, some really reserved. But also not surprisingly, the group leadership, so in the different communities that we're working, who's leading that team of implementers is really, really important. Thankfully, no major technological changes to the tool. And our future plans, to end off, as I said, we're completing the pilot at the end of October. We're hoping to present to stakeholders at an online meeting at the end of the year. We've already started to engage to see how can we potentially further implement and scale up and integrate into other systems, to other sites in South Africa, and looking at how could we expand this, not just to be used with caregivers, because I think I forgot to mention the organizations we're working with have home visiting programs. So the tool is used by a home visitor in the home with the caregiver and the child, but we're looking to see, can this be used now in an early childhood development center about the child. And thank you very much.